Well, good morning, everyone. Thank you so much for joining us. The COVID-19 crisis has really upended all of our lives, and we know that Minnesotans' economic security has really been hit hard during this health crisis. But we also know that we have the resources to help them through the roughest patches of the pandemic. Largely as a result of the Federal CARES Act and the $1.87 billion that Minnesota has received, we are able to step in and help families with housing and so much more. Today, we're taking an important step in the Minnesota House to help Minnesotans keep a roof over their heads, to help preserve their small businesses, to facilitate distance learning and telemedicine, and also to ensure that the workforce that's on the front lines taking care of elderly folks and people with disabilities have the pay that they need to continue doing that important work for our society's most vulnerable members. The legislation that we're passing today will help keep Minnesotans safe in their homes with an investment of $100 million in housing assistance. We're also making investments to facilitate distance learning. I think that what's become clear through the educational implementation during this pandemic is that some of the disparities that already existed have been exacerbated. Also, really importantly, we are providing financial assistance to personal care attendants by proposing a 15% temporary increase in their pay during the time of the pandemic. And finally, our bill provides assistance to very small Minnesota businesses that have been left out of the other economic relief packages. It's important that we give our small businesses the resources they need so that they can reopen when the pandemic comes to a close, or at least when we're on the other side of the surge and the other side of the stay-at-home orders. We know that working together, Minnesotans can get through this rough patch, and we know, thanks to the federal resources, that we have the economic resources to provide the assistance that Minnesotans need. And with that, I will turn it over to the Majority Leader.
Good morning. Minnesota can't afford not to act to make sure that Minnesota families, Minnesota communities, and Minnesota's small businesses have access to resources to survive through the COVID pandemic and thrive in Minnesota afterward. We've had conversations with renters and homeowners, small businesses, with personal care attendants and nurses, people who are on the front lines of providing service in our communities, police and firefighters. Throughout this legislative session, we have been in touch with the people that Minnesota is counting on to deliver basic services, essential work, and to make sure that the things that we need to live our lives are available to us. Those workers, those families, those businesses are essential to our state, and Minnesota has to act to help them get through this crisis. If we do nothing, if we let them fall through the cracks and be left behind, we are going to have a much, much slower economic recovery afterward. We believe that this package of bills is essential to make it through this legislative session. We have less than 2 weeks to go, and in combination with the bills we have already passed for COVID-19 and a robust bonding bill, we believe this will set up Minnesota to not only survive the crisis, but to come out on the other side ready to thrive, more secure, and better able to meet the needs of Minnesotans across the state. So we're going to hear from some advocates this morning on some of these issues with more personal stories, and we're starting with Heather Jesuits from the United Community Action Partnership in Litchfield. Heather?
Hi, my name is Heather Jesuits, and I grew up youngest in a family of 6 on a dairy and hog farm in Litchfield with my grandparents who settled the farm living next door, and my mom was a nurse. We didn't have a lot of extra money, but my parents always found a way to make ends meet. When I was a younger mother, I went through a period where I relied on safety nets like energy and medical assistance, Head Start for my children. And after I got back on my feet, I dedicated and decided that I would dedicate my life to making sure that my neighbors knew about the resources for when they might need them. I'm happy to say that my current job as a family service manager at United Community Action Partnership for the past 19 years, I've been a part of a team of professionals who've helped thousands of our neighbors in the 9-county area across West Central and Southwest Minnesota to get through life storms just as I was able to all those years ago. Housing issues can look different, not only between Metro and Greater Minnesota, but even across our 9 counties. Right now, we're seeing one extra wave of people, and we know that an even bigger wave is coming. Right now, we're seeing families who are living doubled up, 10 or 12 in a house, couch hopping, but now with COVID-19, they're being asked to leave. So those folks are coming to us and needing assistance, including first month's rent, damage deposit, utility assistance, security deposit, etc. But on top of that, when the eviction moratorium is lifted and so many people have lost income, we are expecting an even greater number of cases. We will work hard as we can to prevent a spike in evictions. But what I know as a lifelong resident and community worker in this region is that families can't find safe, decent place to live. They leave our communities and they take their kids out of our schools and they leave the jobs that held in our community, and the whole community suffers. That's why we need rental assistance. In my community, we wear many hats. I also am a small landlord. My husband and I own 3 properties that we rent to our neighbors. If my tenants can't pay their rent, I can't pay my mortgage. Very few landlords have mortgages that are free and clear. And if they face foreclosure, it cycles right back to the loss of housing. Housing we cannot afford to lose these rental properties, because as I just shared, that means we lose whole families that are part of making our communities work each day. We have to make it so people can reside here and towns drift apart and we lose resources. So that is why I'm taking the time to share my story. And I hope that legislators from both parties, from the Metro and Greater Minnesota, can do whatever it takes to invest in rental assistance. Thank you. And on that note, I will turn it over to Lori.
Hello, everyone. My name is Lori Dewson, and I'm joining you from my Santee this morning. First of all, I want to say thank you to Representative Schultz and Lippert for working on this PCA bill, and thank you to the House for making this a priority on the floor today. 5 years ago, I was in an auto accident, which left me with a broken back, and I was unable to care for my daughter who has physical disabilities. And so we tried to keep her at home for a while, but ended up putting her in a facility, a nursing home. And for about 2.5 years, she was there. And just this last January, was able to bring her home. There was an agency that agreed to try to provide her with support. And then when COVID came in, they dropped her as a client, not having enough staff to help take care of her. And it's a big responsibility for somebody requiring 24/7 care. So what it's done is it's left me to try to find staff and keep her well cared for. And right now it's been quite a challenge trying to be her caretaker and find people to work with her. We have one person right now, and we're trying desperately to find more. Lots of people are interested, but when they look at the risk and the pay, and the risk to their own families, and they just, it's really a tough choice to try to take care of somebody else's family at the risk of your own family for the wages that they're currently being paid. I think that Minnesota has left PCAs or the home care system out for a long, long, long time, and other things have taken priority, but now is the time. We need absolutely everything that we can do to keep people in their homes and to make sure that the staff have the personal protection equipment that they need, not just for their own lives and their own families. Maybe they could actually come to work, feeling more secure if they're safer, but also for the people that they help care for. Those are people who could be exposed from a worker who doesn't have that equipment. So we have to think about it on both sides. We need wages that are worth the risk, and people with disabilities deserve that. My daughter deserves to be cared for at home. And unfortunately, I don't want to see her go back into a nursing home. People are dying in nursing homes, even more so than what she experienced when she was there. And she can stay home with the right people, with the right protections and the right pay. So I appreciate all that you're doing and continue to do and support that work. So I'll turn it over to Nikki now.
Hey everybody, this is Nikki Villavicencio from Maplewood, Minnesota. Thank you, Lori, for sharing your story with you. Good to see you. I am a home care client. I wear many hats, but I'm also a mom. I happen to be the chair of the Minnesota State Council on Disability, and I'm also a union member. But today I'm here to talk to you about being a home care client. I depend on my services every single day to be able to take care of myself and my family and get up and do the things that I need to do, including learning how to teach my 8-year-old daughter, which has always been fun. And I'm sure many of you who are watching this understand my pain. But anyways, you know, through this COVID-19 pandemic, some of the things that I have had to, you know, learn how to adapt to is, you know, my family lost a home care worker due to risks of not feeling safe enough due to lack of PPE. And then we also were able to have the privilege of hiring somebody during this time, which I will say both things are just about equally as stressful, because there's just so many unknowns when you're going through that process of both losing someone and then gaining a new person, and having to train them during this time has been really a challenge. And that's why I really wanted to talk to you guys today and just really advocate for more PPE. So because I don't have any wounds, but I do receive services, home care services every single day, my Medicaid does not pay for any gloves or any other PPE. And so therefore none of my home care workers are able to have any PPE. And on a side note, none of my home care workers at this time don't drive themselves. So they have to rely on other people and public transportation. And so those are all things that kind of interweave into, you know, the home care, and why the 15% increase will do so much good for the bottom of the healthcare industry. And I think, you know, as Minnesotans, we all know that we are all connected, and this time has really shown us that our fates are all tied together. And so, you know, I'm glad to see that this bill has been moving quickly, and I really want to thank Melissa Hortman and the rest of the House for making this a priority. And, you know, if there's any questions about how this has affected other home care clients and people in the disability community, I would be open to any questions. And again, thank you for your time. I'll hand it to Brent, sorry.
It's okay. Good morning. My name is Brent Kristensen, and I'm the president and CEO of the Minnesota Telecom Alliance. We're a trade association that represents independent telecommunications providers in rural Minnesota. We're made up of 43 commercial companies, cooperatives, and family-owned companies. Since this pandemic first broke in early March, members of the MTA and other organizations worked with our local communities as they transitioned to e-learning and telecommuting, as schools closed their doors and businesses moved their employees from the office to their home office. MTA members used a variety of methods to accomplish this. Some companies offered discount internet plans to get people connected. Others worked directly with their schools to identify students who did not have broadband and focus their efforts to get them connected. Before COVID-19, we assumed that people who didn't have broadband at home didn't have it because they couldn't afford it. We were very surprised when we discovered that that's not completely true. Most of our members have reported a large upsurge in consumers calling in and ordering new service. They weren't asking for assistance, they just didn't have it at home, and now that they needed it. In the first few weeks of the governor's peacetime emergency, we saw a huge increase in new installs, most of which were not part of a low-income program. At the end of the day, while we got a whole lot of new customers connected, we couldn't connect everyone. There are still parts of the state where good broadband is simply not available. From a broadband standpoint, this bill faces the two issues that we've been dealing with in the field from the beginning. First, it addresses the short-term fix that we need for e-learning and telehealth. For the past 6 years, the state of Minnesota has been working towards the goal of border-to-border broadband. They've invested a lot of money in the state's broadband grant program, and the fact is we aren't there yet. A short-term fix is needed to get us through this crisis. Second, it adds money to the existing grant program to help us work towards that long-term goal. Let me be clear. This additional money in the grant program won't move the needle to done, but will move the needle faster. It, along with private investments and federal dollars, will help get us to the long-term goal of quality broadband for all Minnesotans. I'd like to thank Representative Eklund for his leadership on broadband and his willingness to work with the Senate and the governor's office to get this bill across the finish line. Thank you. And with that, back to Speaker Hortman.
We are happy to take your questions.
So Peter Callahan had asked what the cost breakdowns were, but the speaker answered that in the chat.
There's quite a bit more detail that I couldn't type into the chat. So if folks would like to know, Article 1 of the bill is the small business loans. This was originally the base bill that we're using for today's vehicle, House File 1507. There's $5 million from the emergency loan accounts and $50 million going to small business loans total. And I think Zach Stevenson could go into the detail on that. On the broadband piece, there are 3 elements. There's $15 million available for distance learning, $2 million available for telemedicine equipment, and then $10 million to enhance the border-to-border broadband program. In the housing, the $100 million is all in the family homelessness prevention and assistance. And then in the personal care attendance part of the bill, the $26 million is all in the pay increase. So I don't know, Zach, if you want to speak to how the small business loans, that $55 million is broken out.
Absolutely, I can do that. So on the small business loans, we are focusing in on entities that did not have the opportunity to take relief before. And so we are looking for $11 million for the smallest of the small businesses with less than 6 employees, a further $8 million for businesses between 7 and 20 employees, $10 million for minority-owned businesses, and the balance of the funds replenish the existing small business emergency loan program within the.
And that program was very successful, and my understanding was either maxed out, they've distributed all the money, or is headed in that direction.
Yes, they've maxed out the funds from that program.
All right, next question is from Kevin Featherly, and it's in a few parts here. So we heard from Commissioner France that there will be a revised supplemental budget. Any idea how big that will be? And what about the bills like the House Public Safety mini omnibus bill and others like that? Senator Bach and the governor have suggested a budget cutting special session is coming. Outside of the federal funds for COVID, is any new spending realistic right now?
Well, I will answer the piece on the supplemental budget, and then I'll let the majority leader answer the question more broadly. But we don't yet have the detail from the governor's office on how they will be revising their supplemental budget in light of the new budget projection. And to respond to the comments made by Senator Bach and others, Majority Leader Winkler.
We are in some ways fortunate that the budget deficit announced wasn't worse because it allows us the flexibility and time to start to meet some of the immediate needs with our rainy day fund and our reserves and cash flow account without needing to take drastic action immediately. And so it gives us the time to look at the resources we need to get through COVID and make sure that we're providing a base level of economic security for people, making sure that we have the resources to fight the disease and address the needs of Minnesota. Now, over time, we certainly will have to look at the impact of the disease on the economy and the impact of the economy on our budget and consider all options for addressing it. And so we have a number of issues that we need to deal with now, however, and we are fortunate to have the resources now to be able to address them.
All right, next question from WCCO. The governor is set to address the nursing home crisis this afternoon. What are you hearing from constituents, and what do you think should or can be done to stem the tide of death and suffering at these centers?
Well, I think for those of us who watch the 2 p.m. briefings on a daily basis or listen to them, we know from Chris Ayersman and Jan Malcolm that the reason that the numbers in Minnesota appear to be overweighted in the nursing home area and the long-term care facilities are 2 things. One, our definition of long-term care is more broad than other states. The other thing is our testing has been focused in these areas. So as the health department addressed pretty thoroughly in the call yesterday, we don't anticipate having excess mortality numbers coming out of our long-term care facilities that other states would, because essentially we are very accurately reporting those numbers, and in other states where they haven't focused their testing resources there's an underreport, and some of that those numbers will eventually be picked up in the excess mortality reports. So I think the governor's office and the Minnesota Department of Health have been very appropriately focused in on this and being very aggressive. And my understanding is that while CDC was here, they were looking at several of the things that Minnesota was doing as a model to bring to other states. And I think potentially Representative Schultz has more to add on this point.
Thank you, Speaker Hortman. Yes, so today they are going to roll out more protocols for addressing the pandemic and the virus going through our congregate care settings and long-term care facilities. So what they're going to be probably announcing is more activity around testing and tracing and making sure that the facilities have the right PPE and cleaning supplies to do the disinfecting. So we'll hear about that today at 2 o'clock, but we want to do as much as we can to prevent deaths in Minnesota, particularly of our vulnerable older adults. So I'm confident that our state is going to get there and be a leader, just like Speaker Hortman said. Other states are looking to see what we're doing in terms of keeping people safe by segregating wings and making sure staff don't cross from patients with the virus to patients without the virus.
All right, Peter Callahan has a question he'd like to ask.
Hi, I have a two-part question here, and the common denominator is they kind of have to do with COVID. So the first one is, where's the MFIP money? Doesn't this seem like the kind of bill where you might have put that in as well, the $500 check for MFIP recipients? And secondly, has to do with masks in the house. And the question is, do you have a rule that staff and members must wear masks when they're in contact with other people?
So on the MFIP question, we will be taking up the MFIP bill on the House floor on Saturday. The reason that is in a little bit of a different category is that uses federal TANF funds. It would not be using CARES Act funding. And we believe that all of the items on the House floor today are eligible for CARES Act funding. With regard to masks, I issued some additional guidance to members. There is a little bit of authority inherent in the office of speaker to keep the facility safe, so it doesn't have to be a rules change. And the additional guidance that I have issued to members is that I requested that they wear masks when they're coming in and out, because they will pass within 6 feet of staff, and that if they approach anyone or they intend to have a conversation with anyone and be at a distance of 6 feet for a few minutes or closer than that, that they wear a mask. I have not stated that is a requirement that I will have the Sergeant at Arms enforce at this point. I also have not requested that members wear their mask the entire time that they're on the House floor, but it may be that becomes the standard, that people are required to wear a mask at all times, even while speaking on the House floor, and that we ask the sergeant to enforce that. My hope is that we'll get there through voluntary compliance.
Okay, but you mentioned members. How about staff?
I have not issued any directives to staff. Staff have chosen to mask on their own. My understanding is that the troopers are not doing that, and that the rest of the House staff that I see has opted to wear masks. I think the more we learn about masks and the more we learn the role that they play in cutting transmission, the more scientific data we'll have to underlie a decision on that. But since I did not have access to clear scientific data showing the difference between transmission with and without masks that I could identify, I decided not to go to the enforcement level with the Sergeant at Arms just yet.
Thanks.
All right, Dana Ferguson has a question. Hospitality Minnesota has asked for additional small business emergency loan funding and expansion of that program to include more businesses. Does your bill expand eligibility under that program? And if not, is that something you will consider moving forward?
Zach.
Yes, thank you, Speaker. And yes, it does expand eligibility. The original small business emergency loan program that the governor created was only available to businesses that were closed by his executive orders 4 and 8, which were the bars, restaurants, and places of accommodation. As I think hospitality and many others have indicated, the scope of the crisis has affected far more businesses than those just under those 2 orders. The language in the bill that we'll be taking up this afternoon allows any business that can demonstrate financial hardship to the pandemic to apply for a loan.
All right, I'm not seeing any other questions, and I think we're at our stopping point. So
let me just ask
that,
real quick before we wrap if Representative Lippert had anything to add on the PCA provision. I know he's been working hard on this with Chair Schultz for a while. Representative Lippert, anything you wanted to add that we missed on the PCA pay issue?
I'm just very appreciative of Nikki for sharing her story and for the other stories we heard today too, for Lori sharing her story as well. It's just critically important that we are allowing those with disabilities and older adults to access the care they need right now. And PCAs work extremely hard. They've deserved higher wages for a long, long time. And this bill will go a long ways toward delivering economic security for them and access to care for people with disabilities. So it's a good bill and it's time.
And the other people who didn't say much yet about housing would be Representative Hausman and Representative Howard. I want to make sure we cover all our bases here. Was there anything that we should have noted this morning about the housing piece?
I think our speaker today did a very good job of just laying out the incredible complexities of this particular time for so many Minnesotans under stress. So I think she did a good job.
Great.
Thank you.
All right. If there's any other questions, I presume that the media will follow up with us. I can barely see the chat, but that Dana Ferguson has asked about the future sessions. We will be in session on Saturday on the House floor at 1:30. We won't be in session on Mother's Day, though we'll be working pretty hard the whole day. But you can expect that we'll be in floor session every single day, May 11th through the end. The second year of the biennium, we can't take actions on the last Monday. So I think you can predict that that is when we will listen to retirement speeches.
all right, with that, we'll wrap up. Thanks, everybody.
Thank you.